Imagine trying to design a future hospital. I mean, it's incredibly complex, right? Not just bricks and mortar, but this huge living system that affects, well, everyone's health. Today, we're doing a deep dive into just that. Specifically, how Singapore is using something called systems thinking, a really cutting-edge approach to plan its future hospitals.
That's right. And what we'll do is unpack the key factors, the variables driving how hospitals work, how they all interrelate, and some powerful interventions they've identified. Our main source here is a really interesting 2025 research paper. They use things called causal loop diagrams, CLDs, and network analysis. Pretty sophisticated stuff.
Okay, so our mission, as always, is to pull out the most crucial insights for you. We want you to quickly get a handle on this complex world of hospital planning. Let's get into it. So this idea of systems thinking, how does that actually work for designing something as massive as a hospital? And maybe more importantly, why is it so critical for somewhere like Singapore, especially with its aging population?
Well, the core idea really is just recognizing that healthcare isn't just separate pieces. It's a complex system, tightly coupled. Decisions in one area, they create ripples everywhere else. You get these feedback loops, often with delays, sometimes unexpected consequences. And for Singapore, this is vital. They're dealing with, a rapidly aging population, lots of chronic disease, hospitals getting overcrowded. So they need this future back approach. They kind of envision the ideal future state first, then work backwards to figure out the steps needed now. And a big concept that came out of this is hospitals without walls, basically integrating hospital care much more closely with community services, with primary care, bringing care to the patient, essentially.
Right, that makes a lot of sense conceptually, but actually doing it must be incredibly challenging.
Yeah.
So how do they start mapping all this complexity out? You mentioned these causal loop diagrams, CLDs.
Exactly. The study developed 7 of them, all interlinked. Think of them as boundary objects.
Boundary objects,
Yes. Meaning they act like shared maps or common ground, something visual that helps different groups, clinicians, architects, planners, policymakers, all share knowledge and understand each other. They create a shared language.
Okay, so these maps revealed critical dynamics. What kind of things specifically?
Yeah, some really key dynamics. For instance, there's this thing called Romer's Law. It highlights a reinforcing loop.
Oh, isn't that the idea that a hospital bed built is a hospital bed filled?
Precisely, yeah. Especially with an aging population, just building more inpatient beds can actually become a kind of vicious cycle. It just drives up demand even more.
A real trap.
It is. But then you have balancing loops that try to counteract that. Things like hospital-at-home initiatives. They aim to rein in that demand by providing care in more appropriate, often lower-cost settings, right-siding the care, basically.
So it's about finding that balance. Did the study find it hard to convince people not to just default to building more beds? That seems like the easy answer sometimes.
Well, it's a classic systems problem, isn't it? The intuitive solution, more beds for more patients, can actually worsen things down the line. That's why understanding these loops, visualizing them with CLDs is so crucial. It helps people see those unintended consequences.
Okay, but they didn't just stop at the CLDs. You mentioned network analysis too. That sounds like it adds another layer of insight. What did that show?
It did, and this is where it gets really interesting. They looked at all 7 CLDs together and analyzed the connections. The variable that turned out to have the highest betweenness centrality, meaning it sits on the most pathways connecting other variables, was the need for agility.
Agility. What does that mean in a hospital context? Flexibility.
Pretty much. It's about the system's ability to quickly scale up, scale down, or redeploy capacity. Think about responding to crises like, say, a pandemic. That need for rapid adaptation is key. But the analysis also showed something important. These central variables, like agility, they aren't silver bullets. You can't just focus on agility and fix everything.
Because it's all interconnected.
Exactly. It highlights just how tightly coupled the whole health system is. Agility depends on having flexible building design, sure, but also on having pooled resources, enough trained staff ready to move. Everything's linked.
Right. So given all these complex loops and the need for agility, what practical interventions did the study point towards? What actions actually make a difference for future hospitals in Singapore?
Good question. The study highlighted interventions that tackle those critical loops directly. For example, right-siding care, moving consultations to telehealth or community clinics where appropriate. That directly counters Romer's Law by offering effective alternatives before someone ends up in an expensive hospital bed unnecessarily.
Okay, so it eases the pressure.
Right. And things like improving operational efficiency, pooling resources like staff or equipment between departments or even hospitals, These aren't just about saving money. They're fundamental to enabling that agility we talked about. They make the system more responsive.
And this all connects back to the patient experience, to your experience, right? Things like waiting times, how smoothly you move through the emergency department.
Absolutely. Understanding these system dynamics is the key to actually improving those things. It's about building a system that's not just efficient day to day, but also flexible and resilient enough to handle the unexpected for you.
So, pulling this all together then, what's the big takeaway here? It seems like this systems thinking approach, using tools like CLDs, offers a much richer understanding than just looking at hospital buildings. It gets at the connections.
It really does. These visual logic maps, even though they're qualitative, they're incredibly valuable for strategic planning, not just in Singapore, but globally. They let planners literally see the complex interactions and spot those high leverage points for making real change, points you might otherwise miss completely.
So here's something to think about as we wrap up. Consider your own health care, perhaps in the coming years or decades. How important might the agility of your local healthcare system be? Its ability to adapt quickly to whatever comes next. Pandemics, demographic shifts, new technologies. Could that become the single most critical factor shaping your healthcare experience? What does that make you wonder about the future of healthcare where you live?